Well, Medical Teams International, based here in the Northwest, is on the ground in Haiti, assessing needs of the people there. And Nate Miles, who's from Seattle, is a volunteer working with that group, and he's joining us now live by phone from Port-au-Prince. Nate, are you there?
Yes, hi Joyce, good morning.
Hey, good morning to you. You know, when I talked to you a couple of days ago, you could barely put into words what you had seen there on the ground. Can you describe for us what it's been like so far?
Joyce, it's just been the devastation that you see on television when you get here in real life and just realize the enormity of it all and how much there is. It's an overwhelming thing. The amount of suffering that the people are going through here is just amazing and can't really even be put into words.
What is Medical Teams International doing specifically, and how many folks do you have on the ground there assessing the need?
Right. We have sent 10 teams into here already. We've already given medical assistance to over 10,000 people who've been in need. We've airlifted nearly $3 million in supplies and medicines in so that we could get it into especially the hardest hit places in Port-au-Prince. And really we're assessing the problem that we see coming is what we call the disaster after the disaster. It's in about in maybe 3 weeks, the rainy season will hit here, and that's when the second stage of bacteria comes in, when cholera and some of those other public health hazards really start to happen, Joyce. It's frightening to see what could happen here.
You know, we're looking at pictures right now of the many, many children, and we know that the country there has put the death toll at about 150,000 and climbing. Hundreds of thousands of people have been left homeless. What would be, Nate, the new normal for the average Haitian who is living there?
The new normal, Joyce, it's unfolding. The mental health condition of these kids is just starting to unfold. We're now starting to see some of the more violent nature of some of the things that are happening, how frustration is setting, how looks of despair is now setting in on some of these kids' faces that wasn't there at first. And that's the things that is starting to set in, and we hope doesn't become the normal, but it is what we found in other disasters has been the normal at about this stage of the disaster. Now that the immediate emergency is over, the tremblers have stopped. Now, you know, it's starting to set in that they really are in for a tough time.
We're out of time, Nate. If you were going to leave us with a thought and of your experiences there so far and what we can do to help, what would you say?
One of the things I do is I shook hands with one of the little girls yesterday who had lost an arm, and I was feeling horrible about it. I saw this little boy, Sebastian, who came up, and he had lost his leg, but he had the greatest attitude and the greatest smile, and he said that there is hope for this country, and all I could ask is that we would pray a prayer of hope and survival for the people who are down here in Haiti. I can't stress enough, your prayers are needed, the resources are needed especially, but certainly pray for these kids, especially the kids.
Nate Miles, thanks so much with Medical Teams International for the work that you're doing on the ground and for sharing with us this morning. We really appreciate it.
Thank you, Joyce, and thanks Team 5 for their coverage.
Thank you. So much work to do there.
Wow.
It is such a huge, when I talked to him by phone, he
task.
just could not even put into words just how massive the need is.
Still, and
the devastation.
Continues to be. It is really incredible.
So we can't forget.
Fundraising is still underway.
Oh, big time.
That certainly is going to help.
Yeah. All right, well, Rich, here at home, our reality, feeling pretty lucky.